So the American Academy of Pediatrics just recently published their new guidelines on treating and managing children with obesity. And earlier in December, the FDA recently approved a brand new weight loss drug for children ages 12 and up called Wegovy, or semaglutide, which is a GLP-1 inhibitor. It's become pretty popular over the past year or so for adults, and now it's available to children. And so what does this all mean, right? Now our kids are becoming affected. Really, in my opinion, what this is doing is it's bringing to forefront just how big a problem obesity is in our country, not just in adults, but now in children. When people at younger and younger ages are having these preventable diseases. About 20% of our kids are obese, which is terrible, shocking. When it comes to adults, over half, or about half of adults are obese. I think it's not quite there yet, although it could be. About 30 to 40%. And then almost all of adults, 3/4, are overweight. So this is bad. It's not good. Now, whether or not you agree with giving medications to children and even adults, the real issue is we're trying to come up with solutions to this ever-growing pandemic of obesity and chronic disease. And the medical industry, pharmaceutical industry is providing their solutions to us, which is obviously through medications, therapeutics, and surgeries, which in my opinion is not a bad thing, because there seems to be not too many options for this issue, particularly in America, where it seems to be an environment among many other causes of things that attribute to people becoming overweight and unhealthy and type 2 diabetes and pre-diabetic. So we need solutions. We need help. And it's if we don't address it and solve it, multifactorial, right? Using all the approaches that we have available, science and lifestyle, encouragement, motivation, we're going to end up in a bad spot. Now, in my opinion, the way I see things when it comes to helping people who are overweight and obese, and not just those things, because I always like to say that being overweight or obese is just a symptom of a larger problem, that is not eating healthy, not living healthy, not exercising enough, not sleeping well, stress, right? All these lifestyle factors that we have control of, yet living in our environment, among other factors, making it difficult for us to continue to do and be healthy. But at the end of the day, what is at least good is that these issues are controllable, right? We have control over whether or not we become obese and overweight, whether or not we become pre-diabetic and diabetic, have heart disease, which is a good thing, although it's rather hard, again, living in our environment. But it's important to acknowledge that there are diseases and illnesses and ailments that are not preventable, that we don't have control over, that we need someone else to fix for us. We need drugs, we need surgeries to fix those ailments, like certain cancers and autoimmune diseases and genetic diseases and traumas. Yet obesity, overweight, type 2 diabetes, heart disease, for the most part, in the majority of cases, is completely preventable, completely in our control to get rid of ourselves. Not saying that it's not difficult to do, and that is something we should be grateful for, because we don't have to suffer and we can get better. So when it comes to treating obesity, childhood obesity, adult obesity, preventing type 2 diabetes, heart disease, blood pressure, what do I think we need to focus on? Well, the first thing is realizing that we do have control, taking responsibility, and now no longer making any excuses for it, saying, I'm going to change and I know what I have to do, but I need to do it. And so we do have to eat healthier. We do have to exercise more. We do have to sleep better. And focus more on our lifestyle, or else we are going to end up in a bad spot. And perhaps along the way, for many people, medications may help or surgeries may help. But realize those are treating symptoms. And although in many cases symptomatic treatment is beneficial, you have to also affect the underlying cause, which is nutrition, exercise, sleep, lifestyle. It's hard. It is very difficult when we have access to so many different tasty foods. We don't have time, or at least we don't think we have time to exercise and work out, and we don't make time to sleep well, and we don't put the phone down, we don't turn off the TV, we stay up too late, right? We let stress take a hold of us. But we have to rein all of these issues in and start taking accountability and responsibility for our health. And when you do that, that is when you become healthier. That is when you finally become happier and free. And that is truly, truly getting at the root cause.